unprecedented. We haven't had to deal with these kinds of issues to this level of gravity before. So these situations cause us personal and professional distress, worry, anxiety, uncertainty, and because of that, it's affecting us nationally, locally, and internationally. So it's not just here that we're having these problems, it's across the world. It's really a world pandemic. But that said, and putting that out there, the scope of this particular training is focused on managing and coping with the health crisis that we're facing with COVID-19. So we're limited to that scope today. And we want to explore in that context management strategies for well-being overall. And I also want to acknowledge that what we're going to talk about in this next hour or so are typical worries, typical anxieties, typical stressors. When these stressors get above and beyond what is anticipated and expected when things are unsure or when things are unexpected, that reaches a different level, a clinical level. And we're not dealing with that level here today. We're dealing with everyday types of ups and downs and concerns that we might have. So just being clear on that. I will give you resources at the end of this presentation so that if you have deeper concerns or upsets that go beyond the range of this presentation, you can have resources to reach out to manage those as well. All right, so these are uncertain times. It is important in these uncertain times to find ways in which you can manage your mental health, your physical health, and your spiritual well-being overall. The strategies that we're going to learn today, or that we're going to talk about today, have aspects of all three of these components within the strategies themselves. I want to also explain at this time that the information that I'm sharing with you all comes from many foundations. So it's not just one form or one basis of information. Many of the strategies that you're going to see presented and overall topic discussions that we're going to have to do with information that has been already publicized, well received, and dispersed to the communities all around our nation from the CDC, worldwide from the WHO, World Health Organization. We've got information specifically to the strategies that are going to be mindfulness based, and we've got cognitive behavioral strategies that can be used in everyday lifestyle to be able to manage our emotions. And we've got specific strategies and techniques that we can implement that deal with our physical environment, that comes from interpersonal psychotherapy, for example. Since my background is mental health, that's what I'm bringing to you, is a way to inform our lives through a mental health lens, borrowing from all of these other techniques, strategies, schools of thought, and organizations that exist to inform us better. Okay, so COVID-19, this is what has initiated this pandemic today. What are some of the concerns that come up with this pandemic? What are the things that are above and beyond what we've had to deal with in everyday life? Well, one thing is an illness, right? We're thinking about that we are under threat of an illness, of getting sick. We are under threat of fearing contamination. And because of that, our worry level is up higher than what we normally experience, because we've never had to experience a pandemic during this lifetime. Yes, there was one many, many, many years ago with the Spanish flu, but most of us weren't around then. So we're around now, and this is the first time that we're having to deal with this fear of illness. And what does this illness mean? And what is it going to do to me? And what I'm hearing is that some people get by, maybe they test positive for this, but they're not really impacted with symptoms. But other folks are severely impacted with symptoms. So that fear of, is it going to be me? Is it not going to be me? Is it going to be my loved one? That permeates throughout our lifetime right now. Okay? And with that fear of threat and illness and contamination, we're also faced with how are we going to manage this illness? How are we going to prevent it? How are we going to escape it? Well, there's a number of factors that we're going to talk about that come into play there as well. The next thing is unknown risks. We don't know exactly what is risky and what isn't. We do know that we want to try to protect ourselves from catching this disease, this virus, and from passing it on to other folks. So that unknown risk causes us to then take actions that may or may not be useful. We don't know. There's a lot of unknowns here. And that's one of our biggest concerns in terms of raising stress and raising anxiety. We want to search for accurate and useful information, but guess what? It's not always going to be accurate and useful. Sometimes it's going to be misinformation. And how do we judge what's accurate, what isn't accurate? We have many, many people talking to us about this pandemic, this COVID-19. And information tends to come in bulk and not necessarily jiving with each other, right? So we get misinformation sometimes, but we don't know what's missed and what isn't. We also have to deal with isolation and quarantine. Isolation is huge. People by nature are social beings. And how do we maintain socialness in light of having to isolate at times and quarantine ourselves? And especially if we test positive, one of the things that we're being told is to isolate for 14 days. And what does that mean? Does that mean, okay, I'm a hermit now and I don't do any interaction? Or how can I balance that, having to go into a quarantine and yet still maintain connections? Questioning of our own mortality and that of loved ones. A lot of people pass away from this COVID-19 and many don't. So questioning that, who gets to die, who doesn't get to die? What does that mean? What does that mean for me? What does that mean for my lifetime? And normally we don't contemplate that too much on a day-to-day basis. And now we're in a situation when we're forced to contemplate it on a daily basis. And you may have already had loved ones that passed away or know of other folks, loved ones who have passed away. And then we need to face the changes that are being in place right now. Are these changes permanent or are they temporary? We tend to believe that they're temporary and this will pass. However, we don't know, are there some things that will remain permanent? As an example is, will all these businesses that close down, will they return or will they not? Some businesses have already declared that they will not return. So that's a permanent change. Your favorite restaurant may not open again. Permanent change. And then we have to manage that and deal with that. So these are things specific to what has come up with the pandemic. We have physical, emotional, and environmental impacts from the pandemic. So now we're going to get a little bit more specific. We have economic changes. Okay. One of the broadest economic changes is that businesses close, there's a lot of unemployment, and we don't know how quickly, at least in this state, how quickly it will recover. But we also have economic changes with clients that have been working and maybe aren't working anymore, and then that burden comes upon you to help them out, to see how they can get support, to what happens with their Social Security. All of these things are part of those economic questions, at least, even if there aren't permanent changes there yet. There's job losses and financial concerns. My understanding is that for the most part, providers have maintained their jobs during this time, but many haven't. But even with that, with those jobs, some hours have been reduced. There's been some changes in terms of how you can deliver your job. So those are impacting situations. Separation, distancing from family, we talked about that a little in the last slide. And separation from families or from friends can look different with different types of folks. Some folks just choose to stay home, especially ones maybe that are having young children and they're raising young children and they're not out at all in the community with those children. Well, what happens with the interaction with grandparents and aunts, uncles, people like that, or just friends, right? Play dates, things like that. So there's a lot of uncertainty, heightened anxiety, and there's a lot of grief going on. And it's not just grief about death and dying, but it's grief over the loss of what we once had. And that raises stress and anxiety. Grief over not being able to go out to that movie theater and see that movie at will. Grief over, am I ever going to be able to do that again? Again, that temporary versus permanency of the situation. And there's guilt. Guilt over, well, I may not get it, but my grandma might. Guilt over, you know what? I did get it and I was around people because I didn't really take it seriously. And now I feel a bit guilty that I don't know how many other people I infected. Guilt over a number of different types of human interactive situations that are different now. And then there's a lot of confusion and indecision. And some of that confusion and indecision might come from your own belief system. You might believe that, I'm not so sure that I want to wear this mask. I don't believe that there is this great problem with spreading a virus that I don't even have. And then that could cause some confusion because you're hearing news saying that we have to be socially responsible, right? And protect others as well as protect ourselves. But a lot of indecision might come from that. Or, geez, I want to go hiking. And in hiking, I see that other people aren't wearing masks. So why should I? Or I see, wow, everybody's wearing masks around here and I am not sure that I'm comfortable with it. Things like that. I'm focusing on the mask because it causes a lot of discussion and confusion and decision making with regards to that level of safety as it's put out by the CDC in particular to be able to keep the virus from passing on to other folks. Okay. So what happens with all of these conditions, whether they're physical, emotional, spiritual, and thought, right, belief systems, what happens when all of these things are coming up all at the same time? Well, it triggers worries, and worries are founded in anxiety. So once we have some worries going on, they trigger anxiety, and then that informs our stress. So some folks might worry and let it go. They worry for a minute or two, they let it go. But other folks might take that worry and ruminate on it, perseverate on it, think about it over and over and over. That's anxiety. It gets into a much deeper level of manipulating the worry. And then from that, the anxiety comes from some kind of perceived threat, which might be very well informed by a stress level of some kind. So worries include things like, for the coronavirus specifically, things like thinking about our health, thinking about the fate of others, especially loved ones who are in our realm of connection, thinking about our job security. You have jobs today, but are we still going to have them tomorrow? Or you don't have a job today, will I be able to come back to my job tomorrow? Medical expenses. Now, so far in this ordeal with coronavirus, many medical bills, if you will, have been either suspended, overlooked, that are related specifically to coronavirus. However, that's not going to always be the case. And there's the bills from before. If somebody stopped working because they were terminated or they were laid off, there's still going to be pending bills. With the virus itself, bills can multiply very rapidly, as is with any other illness. But there's that piece. Stability of housing. Am I going to be able to pay for my housing? Is it still going to be stable enough for me to live in it? And from that, we can also take folks that live in residential settings. We know about the elderly, right? And nursing care, how that has been so strongly impacted. Well, we don't know. Is it also going to impact our residential settings? We don't know. We hope not, and that everything is well under control there. But that's another consideration. And then there's that uncertainty for the future. How long will this last? Will it ever go away? If it doesn't go away, what will the future look like? All of these are sources, foundations of worry. And what happens with these worries is that it builds up within when they're not contained, when they're not put in a place where they can exist, because you have to acknowledge that you're having these worries, but they're put in a place where they can exist and not fester and not grow. But when they do, that's when anxiety gets unruly and out of control, and then we're no longer the managers, if you will, of our emotions and our faculties, because it destroys our ability to think clearly, make plans, process, and then take some action. So worries are a real important red flag when we start to notice that we're worrying. Going to look as we go on, how are we going to identify those worries, and then what are we going to do about them? Okay, so in terms of responding to the pandemic per se, what we know is that there is no normal way to respond to what's happening now. This is a new situation. This is an extraordinarily large situation that has gone on for 3 months now, at least at a minimum, if not longer. In some other countries, much longer. And there's no real normal way to say, okay, I'm going to deal with this. There's nothing that we can pull at that we've done before specific to the pandemic. There are things we can pull at that have worked to bring down our anxiety in the past, but it's not to the pandemic. And that's where we get confused sometimes, because we think, I don't have any tools. Well, you'll be surprised maybe to know that you have many tools that you can use from the past to manage here, but you don't have a go-to right now. This has never happened in our lifetimes. So again, we don't have a framework for it. We're developing one right now, right? We're developing an emotional framework. We're developing a physical framework. We're developing an environmental framework. All of these things are coming together. And we cannot come together in the same way we're used to. So there's no normal way to respond or manage the emotions. What is our most typical way of managing emotions? Most of the times, our first go-to is to chat with somebody, get together over coffee, have lunch together, right? Join. And that's not happening right now, or at least the mandate is that we should not be doing that right now. So that normal way, quote unquote normal, what is typical, is not available to us. We have to be creative and find other ways in which we can still come together somehow to do that very first step of anxiety management that comes very natural to us, and that is to join and be in a social setting. So responding to the pandemic, there is no normal way to do it. We've got to find our own new normal, if you will. All right, so we're talking about two different components. There's two components that encompass the uncertainty and the distress that we might be experiencing now. There's stress, and then there's anxiety. And stress is a common trigger for anxiety. Okay, so it typically goes in that order, that we're first stressed out by something, and then we start to worry, which is the crux of anxiety, and then that worry might grow bigger and bigger and bigger, and the anxiety gets bigger. So let's think about definitionally, what does this mean? What is stress specifically? Okay, stress is a response to an external cause, such as a tight deadline at work, or having an argument with a friend, and the argument that you're having with the friend eventually subsides, and then the situation gets resolved. Or with the deadline, you meet your deadline, you get the work in, and then what do you feel? Relief. I turned it in. It's a burden off of me now. Okay, you don't have that big weight on your shoulders. So stress is outside of you. It happens out here. Okay, it's something that is done to you, if you will, by a situation outside. And with stress, it can happen anytime, multiple times a day, but it doesn't need to linger. And it usually doesn't. Once the situation that has been identified as a stressor is resolved or just disappears, goes away, the whole stress situation of that moment is done. Okay, so stress is external. It comes out of nowhere, and then we have to manage it somehow by doing something that results in a completion. Anxiety, however, is not that simple, much more complicated. Anxiety is a person's specific reaction to stress. Its origin is internal, within, okay? And it involves mind, body, and soul all together encompassed into one internal process. Unlike stress, anxiety persists even after a concern has passed. Okay, so the stress is removed, the problem is resolved, you turn in your work on time, you're free, you washed your hands of it, but you're still worried about it. Oh gosh, did I do it right? Oh, I wonder what the boss is going to think about it. Think of a student. I turned in that test. Oh, I don't think I answered question number 3 right. Oh my God, I wonder if I'm going to fail. Oh, if I fail, then what am I going to do? And you notice that with the anxiety, it just builds and builds and builds and builds, and it gets to an untenable situation in which it cannot be controlled, at least not internally. You cannot control, bring it back down. You're spun out of control at that point. Okay, so in more severe cases of anxiety, when anxiety can escalate into an actual disorder. The most common mental health illness or issue here in the United States is anxiety. Of all of our mental health conditions, anxiety tops them all. It's number 1. It is followed by depression, but anxiety is first. So if we think about anxiety getting out of control, that is the point at which we're not going to pursue depth of information in this particular training. We're looking at more the level of stress that might lead to activating anxiety, but it is anxiety that is manageable. All right, so those are your 2 differences. And just remember, they can work together hand in hand. Both stress and anxiety can go together. You can have stress reactions without feeling overly anxious about it. You might feel actually more anger, irritability, annoyance with the stressful situation, but sometimes it comes with a buildup of anxiety. And so that's why we're talking about both of these categories. And actually, when we think about the COVID-19 situation, we've got stress that goes with the COVID-19. And for those of us that don't go the route of feeling a bit anxious about it, we might feel very angry about it. We might feel like, why didn't we prevent this from happening? Why are we having to wear these masks and be uncomfortable all day long? And then that's much more informed by the anger, resentment. And sometimes that comes along with feeling helpless. When we have unknowns and we don't have a script under which to manage that unknown, it can arouse anger. Anger because we don't know what to do. And within that anger, we might also lash out at others around us, at our friends, at our loved ones. We might lash out because they're safe to lash out with. They're not going to go anywhere. At least our loved ones usually don't go anywhere. We can do it with them. But really the underlying tone of the anger that is in response to the stress level that we're experiencing isn't about that person, but it's about releasing the tension that comes with the stress reaction itself. With anxiety, there's less likely to be the anger response, and there's much more uneasiness and worry. There might be more withdrawal actually with anxiety because they're so within. You tend to get so within that you're just not knowing what to do. And so rather than reaching out and trying to say, I'm really worried about this, you might actually get into a state of just sulking within yourself because you're stuck and don't know what to do. Okay, so managing stress and anxiety. This is a paradigm. We want to be thinking about this as a paradigm, and we're going to see it in action in a couple of slides. Managing stress and anxiety, the very first thing that we want to do is be aware. We want to be aware of where the source of this stress is happening. What is it specifically? And in this awareness, it is really important to get a handle and manage, really important to think about one specific source. When we start to think about this is making me stressful, this is, and you've got 5, 6 different sources, it's very, very difficult to manage the stress in that moment. So we want to identify a specific source. You can deal with each source separately. You don't want to deal with 5 sources of stress at once, one at a time. And then you get mastery over dealing with one. But before you can do any kind of managing, you have to be aware. Okay, so we're going to find the source of the stress. Next, we're going to practice a state of mind that helps us move forward with that management. So the state of mind, the way we discover what to practice is that we need to think about when we identify the source of stress, what are the thoughts that I have that go with that source of stress? So I'm thinking, I have to wear the mask when I go into the grocery store. What I'm thinking is, I don't want to wear a mask, and I really think this is stupid, and I really don't think there is a virus to begin with. That's your thought. What's the feeling that goes with that thought? I'm irritated. I'm confused. I'm doubtful about what I have to do. But the other feeling is, I want to comply, because I want to get into the grocery store and buy my groceries. All right, so now what you would be doing in terms of practicing a state of mind to those traits or those characteristics is that you would be recognizing the source of stress. Perhaps is I have to wear this mask to go into the store. The thought is I don't want to wear the mask. And the feeling is I'm annoyed. The practice that we would be doing then is accepting. That's the next thing. Once you get to those 3 levels there, you're going to practice just being with those thoughts and feelings. So you accept what is beyond your control. What is beyond your control is that you want to get into that store, you want to buy your groceries, you've got to wear this mask. Okay? That's acceptance. So you practice. That is not within my control, but getting those groceries is. And so this is what I'm going to do. Then you go about it in a way that you produce some kind of an action plan to self-care. Take care of your personal needs. Take care in a very specific way. Think about how it impacts your life in terms of the plan that you're doing and make changes accordingly, depending on your needs in the moment. So your biggest bang for your buck here is the challenging your thinking. So if you're thinking, I don't want to do this, you challenge that and say, well, wait a minute, what's my gain in this? If I do this, then I get to get my groceries, I get to go home and it's all done and I get rid of this mask, as an example. So you want to be able to go through these processes and be very, very aware. This is a mindfulness perspective here, but it's also cognitive behavioral. Okay. In terms of you as providers, anxiety and stress concerns for providers is, I'm thinking overall, maybe caring for others while sometimes having to, or being put in a position where you're risking your own safety. Perhaps you're going in to help a client and you're delivering groceries, but the client really wants to see you and you're there, and yet maybe the client tested positive. Something along those lines. Following stay-at-home and social distancing mandates while still meeting your job responsibilities. So there could be conflict there. You want to deliver your nurturing, caring self, but you feel confined by the fact that there's a screen between you or there's a telephone between you and your client. Working at this time while still distancing. So some of us still have jobs, some of us don't. But if you still have jobs, and you still need to follow distancing orders, then how do you manage that? How do you navigate that? That could be a very stressful situation. And also being present for your clients while taking care of yourself. And I'm going to add to that, being present for your clients when maybe you are dealing with a very sick loved one at home, or maybe they don't live with you, but still, you know, it's grandma and she's in a home and you're very, very worried about her. And yet you still have to be present for your clients. These are typical kinds of stressors, anxiety types of situations that could happen in your cases. And there might be 100 others. I'm just giving a few examples here. Okay, so some of our most impactful stressors for this COVID-19 situation, the very first one that comes up, and massive amounts of literature written on uncertainties and the flood of the unknowns that we're having to deal with day in and day out. And if you start thinking about when we first came into awareness of all of this COVID-19 business happening back in March, the uncertainties then were a little bit different than they are now. Right? We were much more focused on the virus itself. And now I think where it's moving is that we're very focused on what's the world going to be like. And yet we have to focus on the moment. We can't project too much into the future because we don't have plans yet for that, but we can plan for the day. Health concerns continue, loss of loved ones, and the social distancing. So those are the 4 components that are most important with COVID-19. That said, we're going to get into now tips to manage the stress and the anxiety during the pandemic. These tips that we're going to start to get into, we're looking at both tips for managing a stressful situation and then managing the anxiety that might increase or be aroused by the stress. So the tips can fit both types of situations. They could be things that you can do for both types of situations. All right, so the first thing is we're going to start off with just thinking about mindfulness, respectfulness to our own well-being, to our own sense of being. And that's what really mindfulness is. Mindfulness is a thought process that we want to stay in the present moment. Okay? We don't want to deny what is happening in the moment. We want to embrace it, we want to jump into it, and we want to deal with it. Anything that is left undealt with tends to boil over. Okay? So in order to find some peace or some sense of I can do this, mindfulness comes in very, very handy. Mindfulness isn't for everybody, but for those of you that can embrace the moment, this can be a good tool to have and resort to. All right, so one of the things that we want to think about here is embracing your feelings. It's okay to be angry. It's okay to be scared. It's okay to be sad about what you're missing. All of these feelings are okay. Feelings are wonderful. They're good to have. It makes meaning to our existence. And they're impacted by our thoughts. So if we're feeling, we're thinking. But what we want to really focus on is what are we thinking? So that then we can shift negative feelings into positive ones. So embrace those feelings. Embrace the moment and review successful coping mechanisms that you have used in the past to cope with difficult situations. So what tends to happen is that we're in stressful situations and we feel, I don't know what to do. If you're in anxiety situations, you really feel, I don't know what to do. And then you start to ruminate on what's going to go wrong and what's bad and what isn't working. We want to embrace successes. So that does require reminiscing. It does require going back into your life. And it doesn't have to be way far back into the past. It could be yesterday. How did I cope with the situation yesterday? These feelings, maybe even if you're thinking about, I felt really sad yesterday, but today I feel much better. I'm really worried I'm going to have another down this afternoon. Think about, well, how did you come out of it? What did you do? What made you feel happy for a moment? And all of these successes do not have to be big successes. You got that raise at the job. It could be small successes. Little things such as, you know what, I was able to just take a breath, do a relaxation strategy of some kind, close my eyes, and I actually felt my body calm. That's enough of a success. So really redefine success to something that can be very manageable, tangible, and small. You want to allow yourself to go to let go of the worry about things you cannot control and focus on your own inner peacefulness, because we all have it. So the bottom line here is that we are all resilient. We have capacity for resiliency. Within that resiliency lies peace. Okay. And those moments of peace, again, could be a minute or two, or it could be, you know, I've had a whole week. It's been such a great week. Wonderful. But we don't need a week. We need a moment or two to let our minds calm and feel that we are in control of ourselves. You don't have to be in control of the world. Slow down and think clearly about what you need. And that list making can be a real powerful tool. If I think about what I really need, it might be much more basic and simple than what you imagine. So take it to the reality of, what do I need right now? I need 5 minutes of peace and quiet and calm. All right, let's go make that happen. Okay. Embrace the mindfulness mantra of living in the present, rather than regretting the past or worrying about the future. Those two ends don't really help us manage in the moment, except for when we're thinking about the past, what we did well, and we bring it into the present. That can be very helpful. And then how can that help projection into the future? Is I'm going to use this that I know I've had good mileage on in the past, and I'm going to apply it now, because it's going to lead me down a road that I can manage my emotions better. But all of that is done in the moment, in the present. Really, that's all we can control, is right now, in the present. Can't erase, eliminate the past. It's there. And we can't make the future as we want, like envisioning it, but we can make the future what we want by doing what we have found to be useful and working today, and moving forward as we modify in those present moments. They're not present now, but they will be, and we modify and be flexible with those moments as they come up. Right? So hopefully this makes some sense in terms of how important it is to stay in the present. With uncertainty, which is our top target, if you will, with managing with COVID-19 situations, and pretty much anything else, but for now, COVID-19, with uncertainty, a management tool that you have for uncertainty is stability. You need to find stability, create stability, and one of the ways in which you can do that is to follow routines. Don't change your routine from what it was. And if you have to change some things, like, for example, going to the store with a mask, that's changing the routine. It still preserves the fact that you go to the store, your local store, whatever one your favorite is, and you go, generally you go Saturday at 10. Okay, don't change that. Keep going at those times. And keep your routine as stable as you possibly can. Affirm that which is predictable. Those are things you have control over. What is predictable, you know that the mail will come and get delivered in your house today. What you don't know is, will it come at 10 in the morning? Will it come at 6 p.m.? You don't know that, but you know it'll come. So you just count on that predictability. I will get my mail sometime today. Reminisce. Okay, big part of managing uncertainty. And actually during this COVID-19, there's a lot of literature out on that in the last 2 or 3 months about how reminiscing is increasing amongst us as human beings. We're looking back at what our past had held for us. And one of these aspects of reminiscing, what it does is help us to know that, hey, I had some good times. I'm going to have good times again. We're going to house our hope in the fact that we've had good times before. And you go through memories and you do good things with those thoughts. So reminiscing can be a very powerful healing tool and coping tool to help us move forward. Validate your past successes. I've already talked about that. So not just identify them, but actually validate them, celebrate them. Go back in the reminiscing part, go back and look at your graduations, or go back and look at when you celebrated birthdays and whatever it was. That helps to reaffirm and make real, even in the present, your past successes. Check in with trusted people. This is really important. If you're going to call, if you're going to text, if you're going to email, if you're going to do a Zoom meeting, a Skype, a FaceTime, whatever it is, lean towards those people that you trust so that you can test out your reality and gain perspective with the people you trust. All right, because if you start to venture out beyond that and just take anybody, you're not guaranteed that they're going to be able to help you validate your reality or shift as you're needing to shift in the moment. So stick with those people you trust. Practice the mindfulness. That means staying in the present and acknowledging where you're at with your thoughts, feelings, so that then you can take some action. And then face your anxiety, fears, and worries. Don't let them fester, face them. And then that way you can create some kind of plan to manage them. All right, so in this mindfulness experience with uncertainty, one of the things that we want to do for our betterment, right, to help our emotional stability in the moment is to tolerate uncertainty. There are things you do not have control over, and that's okay. So these are just a few examples. You can come up with 101 yourself. But if you are thinking about, gee, what if this? What if that? I wonder if, okay, it's okay to have those wonderments, but don't act on them right away. In order to practice tolerating uncertainty, you might not want to text your friend immediately. You can text your friend, but maybe hold it a minute. And then the next time you need an answer or a question, pause a minute with it. You don't have to take immediate action. You can take it in another hour or so. Wait and sit with the unknown a little bit, and that builds tolerance. Another thing is you don't want to check the weather before going out. For example, if that's something that gets in the way of your tolerating uncertainty, you can mentally prepare to go for that hike. But you don't necessarily have to check every single weather report and say, and this one says that, and this one that. So I'll take the jacket, I'll take the sweater, I'll take a change of shoes, okay, that's overkill. And that raises anxiety. It doesn't level off the anxiety. So mentally prepare by saying, well, I'll take the jacket just in case, but that's it. I don't need to take the umbrella and the snow boots and that, because that's not going to happen. Right? So that you can move forward. Work on reducing the number of times you consult the internet for updates on the outbreak of COVID-19. Okay? So you don't need to check in 5 times a day and listen to every news episode, let's say, that's on the TV that comes up on your web browser. One time a day is enough, one time a week, and just sit with it and go and do other things. Accept anxiety as an integral part of human experience. You're not going to eliminate anxiety from your life or anybody's life. It's normal. We get anxious, okay? Just as depression is normal, just as stressors are normal. So just accept, I'm going to be anxious sometimes. But in order to really have a good handle on your anxiety, it is important to come up with ways in which you can set it aside. It can still sit there, but I'm not dealing with it right now. Resist the urge to escape or calm your fears by obsessively reading virus updates or anything else for that matter. It's okay to read and be informed, but it's that obsessive tendency, and I have to look and see everything. And then when you're on the internet, that's all you're looking at. You're just looking at those and over and over and over again, and the day has, morning came up, night came down, and you're still reading about the virus. Not healthy. Whoops. Okay. All right. So then in terms of controlling over the unknown, so wrapping this up, thinking about this conceptually from a framework, if you will, both mindfulness and cognitive behavioral framework, we want to identify what it is that you can control. What can you have a handle on? Consider what is within your power and ask yourself the following 3 questions. What's your intention in terms of controlling something? Okay? Intention jives with what we were talking about earlier with awareness. Okay? Intention and awareness go together. So in order to have an awareness of a situation, of how you're thinking and being, you need to explore your intentions in the moment. Also, we're staying in the present. What actions would you like to take right now? And that would lead you to start thinking about the practice. How are you going to take some action? And from that action, you develop a plan. And the plan could be, I'm just taking a break right now and I'm just going to sit there. That's a plan. But the plan could also be, okay, so today I'm only going to look at this internet news one time at 9 a.m. and no more for the rest of the day. So you develop an action to take right away. Then how can I respond? So respond is your third piece, and that's your acceptance. And when you accept something, you're going to respond to it by saying, okay, I get it. This is what I need to do. This is what I'm going to do. Let me see how that works. And you respond in terms of trying to manage your emotion. Really important is to consider those 3 steps. Now, in real life, this all happens very organically. You don't sit there and say, okay, so I learned from that lady that I'm supposed to have intentions and actions. No, you don't do that. It happens organically, but you learn that process and it becomes part of the fabric of who you are. Okay, so we want to cope with feelings of anxiety. These are just a few suggestions. And I put these suggestions out because they're very, very well published. That many people who experience anxiety a little bit more frequently than others, doing something can be the most helpful thing of all in order to gain control. So I put here things that you could do indoors. Because of the COVID-19 situations, we're inside. Okay? So I'm focusing on these specific tasks. Cooking, figure out, and in fact, that's been written about also, that people are baking, a lot of baking going on right now, because it helps manage anxiety and you put your energies into something as opposed to out here in the mindset. Listen to music, podcast, watch TV, play on electronic devices. Okay, so we're trying to not be overly involved with the electronic devices, but guess what? During this time, not such a bad thing, except for when you're perseverating or obsessing about the disease, the illness, whatever. But using it maybe to gather other information, maybe to laugh a little bit, maybe to just get your mind on something else. Talking with family and friends, build, create, design, imagine. All of these things involve some kind of a concrete action to take, and art activities. Now, somebody might be out there saying, well, what about physical activity? Okay, that would be on you to come up with how could you manage physical activity in the home. Exercise, for example. And if, let's say you're a hiker, you really, really like to go hiking, but right now you're thinking, no, I'm not going to go hiking. It's too public, and there might be people. Well, could you walk in place? Could you have a treadmill? If you don't, do you have some way to move in your home and then on the computer watch some beautiful nature scenes and pretend you're walking through them? You have to be creative with things that can get you out of your mind space and into some other negative mind space and into other realms. Okay, so some cognitive activities, and I've been already talking a lot about the cognitions. Challenge your negative thoughts. Okay, so if you're thinking, oh gosh, this is going to be a disaster, so let's challenge that. How could it be a success? Okay, reverse, just ask yourself the opposite question. Check the reality of your thoughts. And one of the ways to check the reality of your thoughts is to ask yourself, is there evidence for this stuff that I'm thinking? This is very cognitive behavioral, but it's very practical as well. I am thinking that this is going to happen. Well, what evidence do I have that this is, I think there's going to be this earthquake tomorrow. Yeah, where's my evidence for that earthquake tomorrow? If you really start to think about it, there's no evidence for that. You might start thinking, well, hot weather, you know, when it's hot, the ground dries and then it's going to shake. Well, again, where is the reality to that? How many earthquakes have occurred during non-dry weathers? You know, challenging. Stop obsessing about what you have no control over and substitute it with an opposite thought. So it's always kind of shifting to the opposite, and then create a plan to move forward so that you don't stay stuck. You've got a way out. You're not sinking in the quicksand. You can pull on that tree or on that rope and you can pull yourself out. All right, so some other management types of activities: crafting, coloring, painting, completing puzzles, knitting, crocheting, embroidering, taking photos, updating photo albums. Let's say you've not photo albums physically, but you might have those too. But let's say you want to clean up your photo stock, if you will, in your phone, on your phone, or in the computer, whatever it is. And then there's a lot of apps now that have coloring tasks that sometimes many people find quite relaxing, to just click on the colors and move forward. These are things you can have handy at home. You can be very creative with crafting. It doesn't have to be official crafting as put out by "this is the way you craft." Anything that you want to do that entertains you. Popsicle sticks. You have a bunch standing in a closet somewhere. Use them. Do something with them. Be creative in terms of being able to release yourself, your mind, from that stress or the anxiety. These are a few more formal, more clinical types of strategies, and I'm going to do a little brain break type of activity with you in just a moment. It'll take us just about 30 seconds. But brain breaks are giving yourself a mind breather. Okay, so I'll show you that in just a minute. Read books, read stories, read about things, talk to your friends, journal if you're into that. Meditate if you're into that, or relaxation strategies. Sometimes with that meditation, something that's helpful are what's called abdominal breathing exercises. We're not going to get into that now, but that's just one exercise that I find incredibly helpful. But there's many types of breathing types of exercises and relaxations that you can get right off the internet too, and they tell you the how-to. Some are very, very simple that you do immediately in a moment, and some take a little bit more time if that's what you're needing. Spend time thinking about the things that you are certain about, especially the things that you're good at. And then hum, sing, learn the songs, the words of your favorite songs. We've had a lot of singing types of feel-good moments over the last 2 or 3 months. It's because singing is such a powerful tool. And you don't have to sing well. This is for yourself. This isn't for people. You're not performing. You're doing it for yourself. Breathe, practice breathing, and then I mentioned abdominal breathing. There's a specific way to do it. I'd be more than happy to talk to anybody that's interested later, but I'm just putting it out there because it's a very powerful tool. All right, so when you're trying to practice, let's go back to the mind breaks. When you're trying to do a mind break all on your own, it's really simple to do. I'm sitting here at a window, and I can look out this window and I can ask myself, gee, what color do I see out there? What do I see that's green? Oh, I see the tree. Oh yeah, I see a car. There's a car standing out there that's green. I can start looking and asking myself, what's outside that? I'm doing the bottom one. Look out the window, and what do you see that's close to you? What do you see that's farthest away? What colors pop out for you? What's the biggest thing you see, the smallest thing? You can do it even in your room. You don't have a window. Look around your room and look and see what pops out for you. What stands out for you as important to just get your mind off of that which is a stressor or an anxious kind of thought or reaction. These are practice tools that you can do anywhere, anytime. You can do it in the grocery store. You can do it in your car, anytime. And it's just drawing your attention away from the negative. So that said, look at this picture. Okay, as you're looking at this picture, what stands out for you first? And this is something you're just thinking to yourself. The very first thing that stood out for you. Why do you think that was important to you? Okay, and as you're thinking about that, what color pops out for you here as you're looking at the picture? And then, what do you think the purpose is of you having decided that this color is important and this person or this aspect of the picture stood out for you? Why is that meaningful to you? That activity in and of itself just takes your mind away from any other negative or unsavory or confusing, complicated thinking that might be going on in your mind. The purpose of this is only to get your mind off of something else, moving it on. Okay, and I just use this picture as an example because it's got a lot going on in terms of colors, faces. There's no, well, actions. There's some actions in there. Okay, and this is for you, for your benefit. So like I'm looking at this and yellow pops out for me as an example. And why is that? Well, I don't know. There's yellow, there's green, there's blue, there's all sorts of color, but yellow popped out for me. And I'm seeing the thing that I'm paying attention to is the smiling faces. That makes me feel happy. I like that. Wow, these people are all kind of smiling. No, they are all smiling. Oh, there's happy people here. Yellow is a happy, sunshiny color. And maybe that's what's making sense for me. You make your own sense, but that's the purpose of it. Give yourself a brain break. Skipping through that. Then finally, another piece of management is to do some positive self-talk. Affirm your resiliency, because we all have resiliency factors. We're all strengthful in terms of being able to manage situations. Some manage them quicker than others, but we can all manage. One of the very powerful ways in which you can move along with your positive thinking is by self-talk. So think, these situations that I'm in right now are temporary, not permanent. I'm safe at the moment. I'm competent. I do something very well, and specifically identify that something. I deserve to be at peace with who I am. I'm a good just as I am. Okay, I don't need to be anybody else or any different way than I'm being right now. I'm good at all. I am doing all that I can for my well-being, and I can allow myself to let go of worrying about things I cannot control and focus on my own inner strength. Okay? All right. So that brings us to wrapping up here. So let's think about, when do you need to seek help? When are these things that we just talked about not just everyday types of stressors and anxieties? When does it become a problem? When you feel like you're going to hurt yourself. When you feel like you're going to hurt another person. When you feel unsafe in your own skin, and that means you just don't know what to do. You're obsessing, you're perseverating, and you're stuck, and you're not productive. You're not moving on with what you have to do during your day. And in fact, you stopped doing what you're supposed to do to live day in and day out. You're having experiences of panic types of feelings 4 to 5 times a week, and they're pretty intense, and you can't control them, and you can't move on from them, and they don't pass quickly. You are experiencing changes in your sleep, eating patterns, or in your focus and concentration. When you're increased and using excessively substances, when you increase and excessively use substances, and you feel hopeless most of the time and you cannot identify hopeful thoughts, then you need help. Okay, this is more clinical help profile. But let's say you're not in the clinical help range. You know what? You can still feel that you need some resources for managing. You can reach out to family and friends, clergy. And it could be a casual reach out, spiritual advisors, peers, coworkers. Reach out to your EAP program if you're employed and they have an employee assistance program. Your insurance providers. Your insurance provider can link you up with, you can look through the insurance book and they'll link you up with positive resources. And maybe if you're familiar with any self-help groups or programs that are appropriate just to engage, do that. Clinical resources are these: 211 is a general public health resource for LA County. Then there's the Access Center, and there's the number right there, the National Suicide Hotline should you need it. And then anytime you have questions, just think about the NAMI, the National Alliance for Mental Health. National Institute of Health can also be very helpful. And then if you're, I put down these 3 apps because I think they are very important. First, Headspace, Calm. They're both readily available to the general public, and they're general calming apps that deal with just clearing your mind, if you will. Headspace is free from now through December, I believe. And then Calm, if you have an American Express card, you can also get it free at this time. Mindshift is specifically for folks dealing with anxiety, and it can be very helpful as an anxiety resource tool. And one final thought here, and then we'll wrap it up. COVID-19 has brought us a new level of fear and uncertainty that we've never had to deal with before. Being worried is a normal reaction to any crisis situation. So don't feel that you're over the top with your anxiety. It's normal. Embrace that new normal. Okay, we've got to deal with this in a new way. Let me see how I can do that. The crisis will not last forever. I said the crisis. The problem might continue in terms of the COVID-19 might continue to exist, but not the crisis. Crises pass. They do pass. And then changes ushered in by COVID-19 are likely to change the fabric of society all over the world. So there might be some changes that will continue on, but then we're going to adapt to those because we're resilient. We will adapt to them. And humans are resilient and innovative and will adapt. Okay, so leaving that with a good thought in your minds. That's the presentation for today. And I think we're going to open it up to question and answers now.
Okay. Yes, we'll go ahead and take some questions. So if you did, I see there's a couple of questions in the Q&A box. So if you'd like to add some additional questions, please go ahead and do so now. And if you're calling in on the phone, we do have the option for you to press *9 to raise your hand, in which case I'll have to unmute you and enable you to speak. But for the questions we have so far, Dr. Mendez, there's a question that says, this is good, helpful information. Will we be able to have access to a data version? I believe they're referring to the PowerPoint, which yes, you will have an access to the PowerPoint. We'll send it out to everyone who registered for the presentation. And for the next question, someone's asking if we'll do this for the George Floyd crisis. We are kind of in the process of planning future presentations. So, it's not certain yet what we'll be able to cover, but we are looking at addressing the George Floyd issue. We obviously know it's a very important topic in all communities right now, but we don't have a set date to address the issue at the moment. But other than that, are there any questions specifically for Dr. Mendez? I'm not seeing anything that would go directly to her at this point. But someone did say, this webinar was very informative and useful. Thank you so much for these tools.
You're very welcome.
Okay, give it just another few seconds. So is Dr. Mendez taking contact after? So you all have my email address. When you registered for the presentation today, you received an email from Rhiannon M at westsiderc.org, which is my contact. So if you would like to address any general questions with Dr. Mendez, I can field them to her. If they are more on an individual basis, we do recommend you follow up on some of the resources that were provided to you. And again, you'll have a copy of this presentation so that you can remember everything that was noted there. So if you have questions, you can email me and I will get them over to her. She will do her best to get back to you. And then we got a thank you. And will the data be sent? Would the data sent be this recorded meeting? Yeah, you'll receive the recorded meeting along with a copy of the slide presentation. I'm not sure if you're referring to a different set of data though. Beyond that, but that seems to be it. Okay. Any future webinars? Yeah, so I'm On this particular topic, I'm not sure if that's what you're referring to, or with Dr. Mendez, we are in the process of hopefully planning some maybe more smaller workshop type sessions for the future. We don't have anything on the calendar just yet. Since we are kind of ending our fiscal year here, we have to do the prep for the following year. So nothing official just yet, but we definitely realize the importance of the subject matter. So we're going to do our best to get some more presentations specifically with Dr. Mendez and addressing many other topics in the coming months. And that seems to be it. Okay. Thank you so much, everybody, for participating. And Dr. Mendez, we really appreciate you being here today and sharing your wealth of information on this topic. And we hope everyone has an excellent day. Anything you would like to add there, Dr. Mendez?
Just thank you very, very much. And don't hesitate to reach out. You can reach out to me through Rhiannon, and I will definitely get back to you.
Okay. Thank you so much. And yes, the handouts will be available. We'll send them to your email. Take care, everybody. Have a good day.
Bye.